Okay, you guys, we're back. I know you've missed us, but we're here with a very special guest today. We've got Dr. Crane joining us today for our Facebook Live. Hey, doctor.
Hello, I didn't realize I was so special.
Yes, very special guest. Very special. Now we need to do is, see who else we can get on here. Star Elite Power for us.
Maybe we
So,
can get Dr. Puntillo on one of these days.
there we go. That would be great. We'll see if we can sweet talk it, make it happen.
Sure.
All right. So we wanted to take a few minutes to, for those of you who check out the Facebook page and maybe haven't made an appointment yet or something like that, want to let you know get to know Dr. Crane. And also too, for those of you that have been coming, just thought we'd share some information about Dr. Crane and then about the amazing services that they have available at their locations. So Dr. Crane, why don't you tell us a little bit about yourself, where you're from, all
Sure.
that good stuff?
Yeah, so graduated locally. I'm from Lowell, graduated from Lowell High School. Did my undergraduate work at Notre Dame, and then did both my dental degree and my orthodontic residency at Indiana University down in Indianapolis. Married to my beautiful wife for a little over 15 years, and I have 3 daughters, twins that are 11 and a 13-year-old.
Wow. That's awesome. Well,
Fun times in my house. Yeah.
Yes.
No drama.
Yes, you are so totally outnumbered there. Well, I'll give a shout out to the Fighting Irish because I'm a Notre Dame fan. So that's
Go
awesome.
Irish. We'll see.
Yay.
Let's see what happens.
Yay. Well, now how long have you been practicing?
Yeah, I was thinking about that the other day. 13 and a half years. Time goes by pretty quickly.
Wow. Yeah. Well, obviously you love what you do.
Obviously.
Yes.
Yeah.
Very cool.
We try to make it fun.
Yeah. Oh, yeah, of course. I mean, people are in there, wanting you to help them create their beautiful smiles or, maintain them, fix them. That's always a good thing, helping people out
I think
that
it's
way.
a special thing. Yeah, I think we're blessed that we get the opportunity to do that.
That's awesome. Well, since you've been in practice for a little over 13 years, what changes have you seen in the practice since you started?
Yeah. So when you think about 2008, that doesn't really seem that long ago, but really the way we've practiced has changed tremendously. I remember after the first year being here, Dr. Puntillo and I discussed cone beam images or three-dimensional radiographs, three-dimensional x-rays. And we put that in 2009, and we just had it at one office at the time, and now all of our offices have it. We were, I think, one of the first practices in the state to get that. So really allowed us to visualize dental problems in 3 dimensions. So gave us better treatment planning and diagnostic abilities to help patients out. So that was a big thing, and it was in its infancy in 2009, and I think now it's becoming more the standard of care.
Mm-hmm.
And so that was, that's 3 dimensions. Really, everything's kind of moving into 3 dimensions. So we don't take impressions anymore. Now we have 3D scanners. So we don't have to put goop in people's mouths, and scans give us accurate representations of exactly what's going on. So it's quicker for patients, and it allows our appliances to fit better. Along with that, we have a 3D printer. So we got the scanner that kind of gets the information, and then we have the 3D printer to replicate it and print it for our indirect braces cases and to get our appliances made.
That is so cool. Yeah, I love the 3D printer. That's amazing.
It really is. Allows us to make aligners and get the braces set in the right position. So when we think about implementing new technology, kind of the 2 questions we ask ourselves, is it going to improve the patient experience, and is it going to improve patient care? And I think in this case, it's done both.
Oh, absolutely. Speaking as a person who had braces, well, centuries ago, but the goop, didn't like the goop.
Right. Yeah. Not the most fun day when we used to have to put that in people's mouths and tell them to breathe through their nose for 2 minutes.
Right. Now, I noticed we talked about before, you guys have the 3D printers, different types of x-rays, but you've switched to a more digital workflow. Was that because of what we went through these last couple of years with the pandemic? Was it something you guys were moving towards beforehand?
Yeah, we've been moving towards it, but I think the pandemic accelerated that. So people are busy, and they want their appointments to be quicker. They want them to be on time, and maybe even less appointments. So One of the things that I think the pandemic really made us take a second look at was something called dental monitoring. So, particularly for our adult patients and our aligner patients, rather than having them come in more frequently just to check to see if the trays are fitting and make adjustments, now we can remotely monitor them. So it's pretty cool. We have them download an app on their phone. They have a special, it's called a scan box, a little box that gives us a scan of their teeth. Do that once a week. That data gets sent to us, and then we review it, and allows us to really stay on top of how the teeth are moving, catch problems early when there are problems, or if there's no problems. I had a patient in last week. He hadn't been in for almost 6 months because everything had been tracking perfectly, and he was grateful that he could live his life without having to take extra time out of his day to come visit us, and everything was moving nicely. So I wouldn't feel comfortable letting someone go that period of time without actually being able to monitor it, because bad things can happen in some cases.
Oh yeah, absolutely. No, I think that's amazing. You guys are able to do that. And then as far as communicating with the patients, you guys do that either on the phone or via text.
Right. Yeah. And that's another thing I think that the pandemic accelerated. We've been doing a lot more communication via text. Even in our personal lives, it seems like we don't talk on the phone as much as we used to. And when we have patients calling in on a daily basis, if we don't get to the phone, they have to leave a voicemail. The voicemail has to get checked, and we have to return the call. And oftentimes do a lot more communication via text, because it's just easier. The patient can text us at their convenience. Even if we're closed, we come in, all those are reviewed, and then when we have the opportunity, we get back to them and we can continue that conversation without playing phone tag. So just another way to improve the patient experience to where they feel like they're still connected and can reach us when they need to, without getting frustrated that they have to leave message after message.
Right, right. That makes sense. Well, now, we talked about how you guys have moved forward with the technology and everything like that, and we've touched a little bit on how the patients benefit from that. We look at more options, more comfort.
Right. Yeah. So we treat a lot more adult patients than we used to, and I think that's primarily because of the aligner options that we have, along with some remote options like dental monitoring and things like that. But even the braces technology itself, since 2008, has changed. The brackets are designed to kind of hug the teeth a little bit better. We use self-ligating brackets, so they have little doors on them. So instead of the assistant having to push in and individually tie each bracket, there's a little door that clicks into place. So it's, even if it saves the patient 5 minutes at each appointment, well, that's 5 less minutes that they have to sit in the chair and get worked on. So yeah, there's a lot of little nuanced things that have changed too. Again, when we look to make these changes, why are we going to make them? How is it going to benefit the patient? And so comfort and convenience is what we look at.
Well, and I love the fact of less visits. I know that probably is not only a benefit for the patient, but for you guys as well, as far as scheduling and all of that. And seems like with everything, with the technology and the communication, all that, you get a more accurate diagnosis of what the patient needs and how you need to move forward.
Right. Yeah. And the one thing I would say, though, with all of the advancements in technology and communication, I don't think it's really changed what our mission is. And so, our mission is to deliver the best care and to give the patients the best experience. And so I think a big part of that is listening to the patient. So we still like to do, most of our exams are in person, because it's one thing to look on a computer screen and see, orthodontically what needs to be done, but it's another thing to actually listen to what the patient desires. And, some patients come in and we could do full treatment on them, but maybe that's not what they want. They just want their upper front teeth straightened. So I just think it's really important to have that interview between the doctor and the patient, create that relationship so that we can actually give them what they need and what they want.
Right, right. Well, this has been incredibly informative. This is awesome. We're so happy that you were able to join us today. I know that I can see we've got some live viewers already, so this is great. You actually had more live viewers than Brenda had, so Just
Oh,
thought I'd
well,
toss that out there.
I'll have a reminder of that on a daily basis.
Awesome. All right, Dr. Crane, thank you so much for your time. And we would love to schedule another one, maybe in the next couple of weeks or whatever, just to see how you guys are doing during the holidays. And oh, we got a thumbs up here. That's awesome. And maybe we can talk Dr. Puntillo into doing one too.
We'll have to twist his arm. We'll
Right.
see.
Okay. Well, thanks again for joining us, and we'll let you guys know the next time we get another one scheduled.
All right. Thank you,
All right.
Michelle.
Thanks.